for tuning in. And guess who's back in real life? It's not animation. Tanya's back. Paul Montenegro and Tanya Stenby. Where were you anyway?
I'm the world traveler here.
Yes,
no,
you are.
actually, you guys are. I was in Norway visiting family, so it was fun.
Wow. So you said you're still a bit jet lagged today, huh?
I am.
Okay.
Yeah, I don't know why either. It's been a week, and I can't seem to get past it. But
Must be all the alcohol.
no, don't do a lot of that.
No?
No.
Oh, well. Anyway, so our topic today, we're going to talk about kind of like interior design, because we've been on this creative mode, and we wanted to say, hey, how does interior design really fit into healthcare?
Right.
And there's a lot of creativity involved in that as well. So I am clueless when it comes to interior design. I mean, you're much more artistic when it comes to that, I think. No?
Not
I mean,
really.
your house is always spotless and nice.
That's just
decor.
cleanliness.
Yeah, but your decor is always nice. So I'm sure there's some sort of mode and thought process that goes along with that. And
Yeah, I'm more of a functional person, honestly, when it comes to interior design. I need it. Well, because we live in a tiny house, so it needs to be functional,
Okay.
right?
So,
But in terms of interior design with respect to why we're here, I think we're going to focus on how it can help in terms of health.
from the healthcare perspective, I mean, let's first look at the healthcare settings and the different healthcare settings out there, right? Let's say long-term care, hospital settings, or even offices.
Yeah.
ERs, right? So obviously there's a lot of function that goes along with that to start, because we have equipment.
Right.
So with the equipment, we need to be able to have certain spaces for that. But is there certain things that we could really think of from those designs wherein is there one more beneficial than other, and is there one more pleasing than other? So, I mean, you're more office-based currently. So maybe let's talk about your office setting. I mean, is there anything there? Is there a mood that you guys try
Yeah,
to
well,
set
since
up?
I am in pediatrics, the office I work in has a lot of murals on the wall. So, you have to have some functionality, obviously, in a medical office. So, it needs to be functional for everybody involved, the patient and the provider. So, but in the pediatric world, you do try to make it something pleasing, an environment that's pleasing to be in. So we do have murals all over the wall, brightly colored, animated type of murals.
What are these murals? Are they like characters, cartoon characters?
Well,
or?
they can't be specific characters because you would need a license to do that, but they look very similar. Let's put it that way.
Okay, kind of like.
So, for instance, like there's sort of almost a cat in a hat theme, but there's. Like some of the rooms have a theme. So in the office I'm currently in, there's the turtle room, and there's different animals that are the rooms. And in the other office, it's more scene related. So there's a circus scene, there is an amusement park scene, things like, and there's a sports arena scene. So these are
each room has a different theme.
Yeah.
They're
not just painted a color. Yeah.
Do they get to choose what room they go to?
No. Unfortunately, no.
And why not?
Because we're too busy for that. Like, we have people in rooms all the time.
So it's just color then. I mean, it's kind of meaningless if you have these different options, different settings, but then the patient doesn't get the choice.
It's not meaningless because in our field they come multiple times, sometimes multiple times a year for sort of well care type stuff, and then they see the different rooms, and it's when I come into a room, for example, when I come into a room and they've been waiting just a little bit, they're often playing I Spy because the walls are busy. So it's helpful. It keeps them occupied.
Okay. Do you have patients saying, "Can I go to this room?" Given they've been there multiple times, can I go to the
No, we
cat
don't
room? Or
actually.
No,
No, they actually don't. Not that I've ever seen, but I don't put them in a room, so
Okay.
Yeah.
All right. I guess the staff,
Right.
the medical staff, puts them in their.
They might be saying it to them on a regular basis. I have no idea.
Okay.
So,
Okay.
yeah.
All right. So that's the office type setting. I mean, let's look at our experiences in the hospital.
Yeah. Ugh. Right?
How about the pediatrics in the hospital? Are they kind of colored or decorated a certain?
Yeah, they're usually decorated in a certain way, like bright colors. But even it's been a long time since I've been on a pediatric floor, honestly. But to my recollection, there might be a room where the mood is much lighter and playful and things like that. Whereas the actual hospital room itself is not very fun. It's much more just functional.
It's, my opinion, it's just quite sterile. It's just...
Yeah. Sterile is a good word.
Yeah, it's just like this... Usually it's white, right?
Yeah.
Or like dark, pearl-like color, right?
Yeah.
It's not like bright white.
Exactly.
So usually it's like a, pearl-type color. And it kind of just doesn't do anything, right?
Right.
I mean, how about having paintings on the walls in the hospital settings, in the rooms?
Yeah.
What do you think about that?
I don't know. I mean, it brings to mind motel rooms for some reason for me, where they've stuck some art on the wall and doesn't mean anything, not really. It's something to look at.
But it makes it a bit more homey.
Yeah.
Right?
Yeah. Yeah. I mean, I don't know if there's certain rules around, having artwork on the wall that collects germs and things like that. I mean, some of these rooms, especially in the pediatric world, they're the sickness is respiratory related, honestly.
Yeah, but
usually. And it's, then you've got germs all over the room.
Well, there's germs on the wall. I mean, so I don't understand why it's an inanimate object that's stuck to the wall. You're not licking it.
I know.
You're not going next to it and sniffing it, so it's no different than having a wall. So I think it just kind of adds to it and maybe a bit more calming per se.
Yeah.
How about plants? Do you find much plants in these settings?
No. Now, but that's a thing, because I think plants are a very healthy addition to any space. I mean, it absorbs CO2, it emits oxygen. It is it's well known that plants are a cleanser for the air. But you have to think about. You have to think about every single thing, and one of those things is allergies.
Pick a plant that doesn't bloom.
Well, it's not just blooming plants that cause allergies.
Like a snake plant, or how about a cactus?
I don't know. But if there's an object that's living, there's a reason to be allergic to it. That's all. That's what I know. Do you know what I mean?
But a plant's very easy to be removed, but then it adds to adds a lot.
I'm not disagreeing with you.
To livelihood. And
yeah.
You know how many patients I have in the long-term care setting wherein they enjoy gardening.
Yeah.
And they would cultivate plants, and so that's a big part of that too. And I think, we're not talking about gardening here, but we're talking about really more interior design. But I think plants should be more into these designs.
Yeah.
And I don't understand why. I mean, it's the maintenance of it's pretty low for the most part. Yeah, there's the initial cost, initial investment on that,
and somebody has to water it. That's about it, though.
Yeah, but how many people are just going in the rooms? Just splash a little bit of water on it, and it'll be fine. So, I think the plants will be a nice addition to these places. Hospitals, office settings. In the long-term care setting, I do see it quite a bit. But again, in long-term care setting, that's where they live.
Yeah, exactly.
I see plenty of paintings and artwork in those settings as well. So were they professionally interior design? I don't really know. I think some of the lobbies, yes, they make it look nicer. It's the greeting place. But then when they actually go in these individual rooms, yes, I agree that most of them are pretty sterile. And I think that could actually change someone's mood.
Yeah, I think so. Yeah.
So I don't understand why, from a healthcare perspective, it's not utilized as much. Yes, there's a cost factor. I get that. But what are we trying to do? We're trying to improve health. So, are certain settings that may be more apt to adopt a more
imaginative.
Yeah, or more intricate thought process when it comes to interior design for these rooms. I mean, I think pediatrics is a big part of it, you know, and that's your world that you live on. I mean, are there certain colors that may be better? You know, what are your thoughts on that?
Well, I think we're going to talk about color again, aren't we?
We could. I mean, I don't really believe too much in the different colors. I think it's a very personal thing of what colors people would like. I mean, all we really see is white.
Yeah.
Even our lab coats are white.
I don't wear a lab coat. We don't do that in pediatrics.
I get that. I don't really want to wear one, but sometimes I kind of have to, because if practicing wound care, there's a lot of things I need with me. So I need to put it in my pockets. When I practice primary care, I don't.
Yeah.
Because I don't need that, but I do bring a bag, because I'll have some other tools I may need in there from a diagnostics perspective.
Yeah. Well, so I mean, in any case, I do think the design of an interior can definitely have an impact on the mood and the ultimate way that somebody feels when they're being cared for in a healthcare setting.
So let's do a quick recap on what do we think are quick things that could add into the mood of the room that's not very expensive.
Yeah.
In case we have hospital administrators looking and, you know, watching, and they may kind of get inspiration from us. So, I mean, I think plants are one big one. I mean, and pick something small. It doesn't have to be a big plant, you know, just pick something, you know, pick something small. What else? I mean, is there specific colors?
Color on the wall.
What besides white, what would you do?
In a hospital room, for instance?
In a hospital room or a rehab room, long-term care setting?
I mean, blues. They're
blue?
calming. Yeah.
Have you seen a blue wall in a hospital?
And blues and greens.
I don't know about blue. Maybe like a light blue?
Why are you arguing?
No, I'm not trying to argue. I'm just trying to think about it. Yeah.
I think, I do think blues and greens are calming colors, and they can help in a office setting, when you walk into a room and it's blue or green, it makes you feel calm right away, rather than a sterile white wall.
It doesn't make me feel calm.
What does it do for you?
Nothing. I'll become probably a bit more annoyed. Like, why is this thing green? Why is this thing blue? Now, a light blue up on like a ceiling instead of a white one, right? Like a light hue of blue. I think that's nice, because it kind of simulates the sky.
Okay.
What do you think of that? Huh? So I think up, when you look up, like a light blue is kind of like feeling of outside.
You mean when you're in a hospital bed and you're looking up? Okay, I'm not thinking about that. That's not my scene.
And then you add some plants, so you kind of feel like you're in nature.
Yeah.
That's my feeling of the cheaper ways for interior design.
Plants and paint.
Plants and paint. No green. I'm not into the green.
I am.
So what, will you green on the wall? I mean, make the green be the plant.
Okay, the green's the plant. The sky is all around.
I want to say all, you know, just maybe.
All around.
Okay. So that elevates the mood from a functional design perspective. Is there anything that we could think of from a functional perspective? I mean, there's a lot of equipment that we need in these rooms.
Yeah, I mean, to a certain extent, you can't get away from certain things that you just have to have in a room, you know. Yes. And they need to be in a functionally appropriate place.
How about the floor?
What about the floor? The floor has to be cleanable, right?
Okay, I mean,
so it can't be wood, for instance.
Why not? I actually like wood. It's very earthy.
No, I like wood. I think it warms up a room, and it's nice to walk into a wood floor. Maybe fake looking wood, or fake,
like the Fox type. Yeah, like the engineered wood, that type.
Yeah, you have to be able to clean it. It has to be waterproof, and it needs to be.
Yeah, you just have to be pour bleach on it, basically.
Yeah, basically, yeah.
So, can you bleach? I think you could bleach those engineered woods. I mean, I think tile will be too hard and too cold, right? And there's also a slip factor we have to consider.
Yep.
That's why I think wood is better. How about carpets?
No.
Allergies,
100%,
right? Yeah.
No.
And then you spill blood on it, then there's a blood stain.
Yeah.
Wound on that. Somebody vomits.
Yeah.
But these are realities of healthcare.
I know.
Huh?
Yeah.
Realities of nursing.
Yeah.
Yeah, pooped on, shit on, farted on. I mean, that's just part of our life.
Yeah.
So, okay. So no carpet.
Yeah.
I like wood. I don't know why you don't like wood.
Well, because wood, real wood, you cannot have in a hospital setting or even in an office setting where there's biofluids hanging around.
Yeah, it could get absorbed.
Yeah.
I wonder if it's part also a fire hazard, right? If you're in a big hospital building, the more wood you have.
Yeah, the cost too is
Yeah.
outrageous.
So just simple concrete and paint it. What do they use now? They use a lot of linoleum
No,
stuff,
they
right?
use linoleum type. Yeah.
Okay.
Yeah.
But make it like look more tile-like to make it a bit nicer, not just that one bare.
sheet.
Yeah,
Yeah.
one bare sheet. Okay.
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 All right.
Is that anything more you can think of from the interior design perspective?
Nope.
That's it. So we talked about color, plants, the wood. How about lighting?
Let's talk about lighting in another episode.
Okay.
Yeah.
But we should give them some light, right?
Mm-hmm. Yeah, they shouldn't be in the dark. For
Shouldn't
sure.
be in the dark.
Yeah.
Okay. Alrighty. Well, that's our interior design input
Yeah.
when it comes to rethinking healthcare. We think the current settings are not very good. At least I don't think so.
Right. Agreed.
Sparse it up a little bit.
Yeah.
Alrighty. Thank you much for tuning in. Talk to you soon.
Bye.
Bye.